My challenges in life were to do whatever God gave me the strength and the gifts to do. And I'd always done fairly well in the academic setting, and I've always loved athletics. And the world of medicine gave me a chance to be challenged academically and yet achieve something and see results. I like to see something fixed and see it get better. And in the world of orthopedics, we definitely are able to do that. Well, my wife's from Fort Valley. I like the Middle Georgia setting. I went to Mercer. Both my wife and I went there. I have a son who's now a senior at Mercer. I now take care of the Mercer athletes, and I have for 13 years. So coming back to Macon, I offered a chance to essentially come home. Orthopedics deals primarily with the extremities, joints, bones in particular. And so in the world of sports, we have a lot of orthopedic injuries. But sports to me is not a young person's thing. When an older person who likes to go fishing, likes to play golf, can't do those because their knee or their shoulder hurts, then a replacement or repair of those large joints makes them an athlete again for their age. We have weekend athletes, we have people out cranking lawnmowers. The shoulder is a very stressed job, whether you're playing sports as a kid, or you're working in your yard, or you're just doing the things that we do in life. It's the most mobile joint by far that God gave us, and it's very prone to injury. Many of those things we can fix. Only God does the healing, but many times we can fix and get it much better and let it heal appropriately. Rehab plays a huge role in all that we do in orthopedics. Most of the time, a mild injury can be rehabbed and avoid a surgery altogether. After a surgery, rehab plays a huge role. I do basically knees and shoulders, and they're totally different. A knee only moves about 120 degrees anyhow. Shoulder has 360 degrees of motion in multiple different directions. Shoulders are 20% in the OR, 80% rehab, because after you fix it, the muscles that move your shoulder are actually stronger than the ones that we fixed. And you've got to be able to control those stronger muscles. You can damage what you did in surgery. So shoulders are especially important in the world of rehab. Around the country, surgery centers are probably one of the best things we have done, at least in the field of orthopedics, in the past generation. Because in a hospital, which does a fine job, but you're a number. You're especially in a large hospital, you get lost sometime in the shuffle. In a surgery center, you're an individual, and the whole center is catered to the person. It lets me as a surgeon operate faster because I have my own set of anesthesia, my own set of nursing, and we can go back and forth between two rooms. The key is efficiency. And surgery centers are more efficient. Patients love them because they get in and out quicker. They don't spend a whole day, and overall we get an excellent result. Used to, we ordered an MRI, it took a week to get it and get the patient back. Now often we can get it the same day or the next day. Having an MRI on site is much more efficient. We have more control of the scheduling. We have the ability to see a patient in the morning, get an MRI by lunch, see them back the same day sometimes, and really get a quicker turnaround. So it's far more efficient and far more beneficial to us and the patient. Several of the doctors in our group have a nurse practitioner or a PA who assists them both in the office and in surgery, and it is very beneficial for ourselves and our patients. A nurse practitioner or a PA brings a huge advantage to the practice of at least an orthopedic surgeon. I see patients, I do surgery on patients, we have to follow them up after surgery. I can only be in one room at a time. By allowing me to see new patients and check on problems that require my attention, my nurse practitioner can see the people in follow-up the first time, usually the second time I'm seeing them, to make sure they're on protocol. If they're not, I go see them as well. It's more efficient. She gives most of the shots that I give. We'll give sometimes 30 and 40 shots in a day, and that just takes time. She's very good at that, and she's able to do that. In the operating room, she can help me by helping me close wounds and helping me hold this and hold that to get better exposure. And I can have somebody that I've trained, not just somebody who the OR provides. So it really is more efficient and better for us, me as a surgeon and for my patients.